relates to routine appointments or medical interventions that are not an emergency. These could take place in a hospital, community, or a GP setting. In Surrey Heartlands, we are looking at new ways to improve planned care for our citizens and carers.
In an ideal world, all of our health and care needs would be met in a scheduled or in a planned way, so that we emphasise prevention, we keep people well as much as we can, and we reduce the number of emergencies or unscheduled need for healthcare across our system.
So our patients and the staff tell us we do lots well in planned care, but there's also lots we can do much better at. So waiting times is an issue, how people get referred to different parts of the NHS, how we communicate with patients about what's happening next, and also allowing patients to take more control of their care themselves. People are saying they want to be able to do that more.
We should be ensuring that everybody in Surrey Heartlands has access to the same care and can expect to receive the same outcomes as anybody else in Surrey Heartlands, and actually that should be as good as it is anywhere in the country. To ensure that we standardise the care across Surrey Heartlands, we've worked together as a system to produce a set of planned care principles.
We've created a blueprint for planned care so that wherever someone lives in Surrey Heartlands, these principles should help ensure a consistent, efficient health and care system for all of our population. These principles have been designed through research with citizens, carers and health and care professionals, not only within Surrey Heartlands, but also drawing on national and international best practices. All of this feedback has been brought together to make a unique and tailored set of principles to provide the very best planned care for our residents. As health and care professionals, we know that one size doesn't fit all. How our patients choose to access care is very important. So whenever possible, we should be flexible and offer personalised care options. We should ensure our citizens are closely involved with any decisions about their treatment, and all possible options are discussed with them. Emotional health is important to us. We should ensure that everyone's well-being is prioritised at each stage of their care. We want to give people information and guidance to support any care they receive, and also how to help live a healthy lifestyle. There are many different clinicians who could be the best person for our citizens to see. We should ensure, wherever possible, they see the right specialist at the earliest opportunity. We know that traditional appointments don't suit everyone's lifestyles, so we should offer alternatives such as online or telephone appointments. Too often, we have relied on outdated methods of communication, which can cause unnecessary waiting times. Better use of technology will ensure we can find smarter ways of working. Dedicated support should be available for complex conditions. We want to help citizens and carers navigate the multiple specialities involved in their care to make it as easy as possible for them. All of us will need health and care support in our lifetimes, so it is important that our whole population has equal access to the same services and standard of treatment, no matter who you are or where you live.
Building on the really good piece of work we've done in establishing the planned care principles for Surrey Heartlands, I think it's really important to acknowledge that we've got some great work that's going on in pockets around Surrey. What we need to do is bring about some consistency to make sure we share best practice and we spread best practice across Surrey.
My vision for planned care for the people who live in Surrey Heartlands is that when they need to access the NHS for pre-arranged care, they get it quickly, they get it as close to their home as we can deliver it, and that it is delivered by high-quality clinicians who deliver great outcomes.